Infection, bacterial versus viral. What makes us sick? Classification. Both bacterial and viral infections are caused by microbes. The difference depends on the type of microbe, bacterial or viral. Both types can be spread by coughing, sneezing, contact with infected people, contact with contaminated surfaces, food and water, or contact with infected animals. Viral infections are caused by viruses. Viruses is a tiny microbe and is smaller than the largest bacteria. It cannot survive without a host. Bacterial infections are caused by bacteria. They're relatively complex, single-celled microbes and can reproduce on their own and survive in extreme heat and cold, including the human body. Signs and symptoms. Unfortunately, the symptoms for both bacterial and viral infections can be the same. Coughing, sneezing, fever, inflammation, vomiting, diarrhea, and fatigue can represent both, as these are ways the immune system tries to rid the body of infectious organisms. A virus may last from 10 to 14 days and will not respond to an antibiotic. If the illness persists longer than 10 to 14 days, a bacterial infection is suspected and initiation of finding the cause and treatment should begin. Treatment. What is the difference? Regrettably, due to the makeup of the organism and the difference in structure, treatment varies because not all infection will respond to the same medications. Antibiotics are not effective against viral infections, and the overuse of antibiotics causes resistance as bacteria can adapt and change, making it more difficult to treat infections. Therefore, it is important to confirm the infection bacterial or viral. Diagnosis. A doctor may be able to determine if an infection is bacterial or viral based upon medical history and a physical exam. Blood and urine tests may also be beneficial to confirm a diagnosis of bacteria. Usually a fever due to a bacterial infection will be higher than one seen with a viral infection and will get worse a few days into the illness rather than get better. Viral infections usually last for 10 to 14 days. Is an antibiotic needed? Bacterial infections can include strep throat, tuberculosis, whooping cough, and a UTI. Antibiotics are needed. Virus includes the common cold, the flu, sore throat, and no antibiotic is needed. Infections such as bronchitis, ear infections, or sinus infections may need an antibiotic, and this will be determined by your primary care physician. Prevention. Wash your hands. Hand washing is the single most effective way to prevent the spread of infections.